good afternoon, good evening. I'm your host, Genevieve.
Carly.
This
And
is
Caroline.
Unbridled Live, and we've got Caroline Rossner on for part 2 of talking about, I think the goal was performance conditioning. You've got a whole list. Like, what
Yes,
are you
so
thinking about covering
I've uh,
today?
I've kind of structured this into several different things. So this is going to be kind of a continuation of where we left off last week with kind of the pre-show season setup, which we're kind of in that pre-show season for games. Other disciplines like hunting are kind of over for the season, but that doesn't necessarily mean you can't still apply some of these things. And then I think for next time, my structure was going to be immediately sort of pre-show. So like the competition is this weekend. What do I need to do to help prevent injuries on the trailer, things like that. So this is still sort of a spin-off of last time with a continuation of going up to leading up to the beginning of show season. So
love it.
yeah. So
I'm
I guess I'll
excited.
just
I'm
start
just
babbling
sharing this
on.
with a couple of people, so you're good. You can continue.
Excellent. So I guess kind of leading off from last time where we talked about, vaccines, preventive health things, paperwork, stuff like that. The next thing kind of on the list as far as routine care, I've got dental care on there. So, for younger horses, ideally you're wanting to check their teeth more frequently as they're growing, because they're going to be shedding their baby teeth and having their adult teeth come in. And obviously we can have like malalignments, things like that. But as they get older and as they have their permanent teeth in, certainly those are things that we want to keep an eye on, because dental care is important. Being able to effectively chew their food can help reduce incidences of things like choke, but also that chewing is going to be vaguely important for colic prevention as well. Because saliva actually has a buffering effect. So the more time they spend chewing their food actually can be very beneficial for their GI health as well, because then you get shorter stem length, which is more easily digestible, as well as they're going to be more effective at digesting it if it's broken down into smaller pieces as well. And so, depending on your horse's mouth and what their conformation is, at minimum, they should have their teeth checked once a year, because even if they have great alignment, the upper jaw is naturally wider than the lower jaw. And so as those teeth wear, their teeth actually do grow over time. So unlike people where our teeth just come in and then you're stuck with what you got, right? You either got good teeth or not. And unfortunately, coming from a British background, I'm pretty prone to cavities. So,
Yeah, same here.
But, horses' teeth are consistently growing. And so when you have a grinding surface that doesn't quite line up evenly, just because of the way their heads are conformed, you will get sharper points on the cheek side, so the outside of the upper teeth, and on the tongue side of the lower teeth. And then depending on their front to back alignment, you can have hooks that can occur as well. And so by
that like gives me
at least
like
looking
for
at
so many years I never understood why that actually happened, which is crazy, right? Because we've had a really great dentist for many years, but I never realized that was why it happened top to bottom specifically.
Yeah, so I'll draw you like a little very sad tooth diagram very quickly, and kind of show you why this happens, which don't judge my drawing skills. I am not an artist. And so this is if we were to look at the horse from the front with their mouth open. Like I said, do not judge my drawing skills. Can you see that okay? So you're looking at the teeth, and so these are the upper teeth. So this outer edge isn't going to line up quite as well. So you're going to get points on that outer edge, and then points on the inside edge of the lower jaw. So
Makes sense because of the kind of slope.
Yeah, so
Okay.
and because the lower teeth are going to be set more towards kind of the midline of the horse, so you're not going to have this little inner point right here wear as much. And same thing on the outside. My drawing's just not the world's
No, that's
best.
really interesting.
That
I
makes
should
sense.
submit that to an art show. See if I can make some money on that one. Interpretive art.
I know.
But you get wear and tear, both when you're looking at them, front to back, but then when you're also looking front to back this way, if the upper teeth don't quite line up with the lower teeth, you can get where you get this hook kind of wearing, where they're going like this and they're chewing, but it doesn't get that hook, and so that can
Yeah.
inhibit the movement of the jaw as well. And so ideally they should be checked annually, and a lot of times even an annual float is going to be helpful, just because you do get those points building up, and ideally we want to address them before they start damaging the cheek. Because if you've ever bitten your lip, once you
Yeah.
get that irritation to it, it's really easy to then keep biting it.
Mhm.
And so
Which is
that
why
can
if you have a
cause
horse that's really
discomfort.
not accepting the bit, you should consider getting dental work done, right? Or at least a
Absolutely.
review.
Yeah, absolutely. Having it, having things checked out, because especially in some of those kind of quarter horsey types where they have a lot of jaw muscle, there's not a lot of room between those back
I thought about
molars
that.
and the inside of the cheek. And so, when you start to ask them to go in a frame, a lot of times you can get some pinching back there as they're going in a frame, but you can also get pinching between those front molars, from where the bit sits in the diastema. So between the incisors, which they use to bite off the grass, and between the molars that they use to grind, you can see that sometimes you can get some pinching in there too. It's also good to check for wolf teeth. They tend to sit right in front of those molars, and they're single rooted teeth. So a lot of times they're not as sturdy. And so if you've got a bit bumping into those, they can actually cause the tooth to wiggle and to move, and that can be uncomfortable as well. So I think it's good to check once a year. And if there are some points, even if they're not super severe, then it's good to just go ahead and get them taken care of before they become an issue. There's some that do very, very well, and can go a couple years in between floats without having a whole lot of points and wear and tear. But ideally we should at least be checking once a year. And if they have known issues, so they're missing teeth, they've got a wave mouth, they've got some malalignment that's causing uneven wear, oftentimes they may need to be floated more than annually. Blitzen, for example, he was 29 years old when I got him. He started out with about 7 molars left when I got him, and was down to about 3 by the end, and none of them lined up. So usually when you get to age 22, 23, you actually stop seeing growth of those teeth and you start seeing more wear and tear. And so as those roots start to age, you'll see that the teeth start to get loose. And when you start having missing teeth, those teeth that are adjacent to them can stop having that wear and tear when they're chewing. So then you get overgrowth and you can get a step. And so there are certain oral conditions that are going to need more frequent maintenance. So
Maybe it is a good thing that our teeth just come in once and don't. Can you imagine if
right,
you lose a tooth and it just grows
right,
in?
and then you got another tooth like growing all the way down.
That'd be
So
horrible.
Like
right,
I
it'd be
had
crazy.
thought about
So
quarter horses too, having like the thicker jowl and everything, how that could actually cause restriction. Because I think about how it is harder. Well, Kiro is kind of a good example. Like he tends to try to over like drag his jaw, but then he does a little bit of roaring, a little bit of grinding. You try to teach him to open up. I think somebody had constrained him too much at one point. But I wonder if that's part
right,
of it too, is that he's a very muscly guy back there. And maybe it does
yeah.
just kind of jam everything together.
And sometimes there's just, there's not enough room. It's also good to have, someone taking that look, because we can also look for, enamel defects, caries or things like that that can cause pain without being overtly obvious.
Yeah.
So certainly it's good to rule out dental issues, especially if you do have a bitting issue. And there are nice alternatives if you do have some things that are less useful as far as comfort with a bit. So there's, hackamores, bitless
Yeah.
bridles, things like that that can be effective as well. But, that was kind of part of my routine care. But it also does lead into improved GI health, because you do get that buffering effect of the actual saliva. And so this will kind of come more into play when we start talking about the GI tract. But, horses are natural grazers in the wild. They're moving around place to place, foraging for, upwards of 10, 12, 18 hours a day. And so that chewing will produce more saliva. And the more you get, they're swallowing that with their food. And so that can actually have a buffering effect in the stomach as well. So that can help reduce the incidence of gastric ulcers and things like that, which I've got an entire section on. So we'll go into more detail on that later. Speaking of drool, my cat has just drooled all over my arm, and that's
I like
disgusting.
that Kimberly here. She said, if human teeth keep growing, you would look like a rabbit if you called out Kimberly.
Right? Which, rabbits, their teeth also do grow, so you have to actually take care of them because they can have lots of similar
Issues with
teeth
them
issues. They're
continuing to go down. Yeah.
Yeah, so horses and rabbits are both hindgut fermenters, so they're actually pretty similar.
Oh,
Um, so fun fact, uh, yeah, the more
that's so
you know,
funny.
just a
The
lot
more
smaller
the more
and
you know.
surprisingly more breakable. Um, I don't know, rabbits are not sturdy at all. So for
Now,
these coming up, keep that in mind.
so talking about teeth though, right? That's kind of average situation. As a horse gets up in age, though, they tend to get more flat-mouthed. Is there a point where the dentist or the vet has any positive effect, or is there kind of a dwindling like return
Yeah,
as they get
so I
older?
actually find that as they get older, it's more important to do their teeth. The younger
Okay.
horses tend to just have more points and issues like that, unless you've got specific, malalignment issues. But older teeth, as they start to wear out, will get something called cupping, where instead of having your nice grinding surface, the surface of the tooth actually looks like a cup. So the edges will be a little bit longer, whereas the middle part, where the root and all of that comes in, tends to be worn out, and it starts to cause this cupping effect. So, top and bottom, the
Oh,
teeth look like this. And then when you try to grind, you actually
gotcha.
get decreased lateral excursion of the jaw because they can't go past each other.
Mm.
And then you've got missing teeth, things like that. Eventually, when they get super duper old, especially if they've not got a lot of surfaces that meet with each other, it's still good to check every 6 months or so to make sure we don't have loose teeth. Those upper teeth actually do communicate with the sinuses. So if you've got a loose tooth, you can actually have sinus infections that can occur because bacteria can kind of travel up that loose mobile tooth into the sinuses. But
Val has a
um,
good question here. Do the teeth actually grow like a rodent, or do they develop the full mature tooth and it drops down like a mechanical pencil lead? I feel like I read that somewhere, but who knows if it's real.
yeah, so essentially the tooth is producing more and more tooth, so it continues to grow down. So those roots continue to grow down. So it doesn't just sort of come down in increments like a pencil lead would, but it's continually growing throughout their lifetime until they hit that kind of 23, 24-year-old range. And then you get a significant decrease in growth and eventually a cessation of growth. And at that point, we're really just trying to maintain the most even chewing surface that we can. So
Gotcha.
hopefully that answered your question.
Yeah, because I
Um,
feel like when I look at a diagram, like the root is quite long on it. And that's
mhm.
where I'm the same as Val. I kind of always thought that like I don't know, it was mature in there. Like you only have so much tooth and then it just like comes down and then it's gone. So that's actually
So,
really good to
the root
know.
doesn't necessarily come down, but as the teeth start to wear out, you'll get kind of
It's
root
like
resorption and less growth and things like that.
that
So
makes
it's not
sense.
like you start with a tooth this long and over time, as it
It's like
comes
where
down,
does
it
it
kind
all
of
come
disappears,
from?
but you do get reduction of that root over time, and that's where you get some of that loosening because as the root starts to resorb, you'll see that the periodontal ligament can get loose, and that's where you can get those loose teeth that come out. So I think
Interesting.
as they age, it's actually more important to watch their teeth. And there may not always be a ton that we can do about it. I can't change the wear and tear that's going on, but we can make it as possible as we can to chew their food effectively. And then once they're at the point where they really can't effectively absorb nutrients from that hay or that forage, then we have to start supplementing in other feeds like senior feeds, soaked beet pulp, alfalfa. There's all kinds of things that we can do. I like to try to have forage in their diet still, but it needs to be in a chopped form that's going to be
Yeah.
small enough for them to effectively swallow and eat without necessarily having to be able to chew it. So,
Yeah. So they don't quit
um,
it up. Yeah.
yeah, yeah. So, yes, I had a toothless old horse for 8 years, and they're expensive to feed, but it's well worth it.
It
Um,
is. Yeah.
but
It's
I
just a
spent
totally
a lot
different
of money.
thing. It's so
Yes,
interesting to me the more that I try to get perspective on being a new person in equestrian sports or a new person or a new family coming into horse ownership, right? Because first they think I just need the horse, I need the buckets and the feed and the water, or
that's
I
the
need the barn
least
to keep it.
expensive part is
I
buying the
know,
horse.
right? And then you're
Uh,
just like, no, but you need, I mean, horses need dental, they need farrier care, they need vet care, they need to have, good food or nutritional
mhm,
assessment. Like there's so much more that goes into horse ownership. So, Pony Club
right?
manual, guys. I think even if you
Yes,
don't attend Pony Club, a good
yes.
D1, D2 manual is fantastic.
Absolutely.
Caroline, I had a question. So, I don't know where I heard this from, but what's your opinion on who should come do dental care for your horse? Should it be a veterinarian or should it be like a
So,
dental specialist?
you know, lay dentists are people that don't have a DVM or a VMD degree associated with them. I think it is going to be really important to have a veterinarian actually assess your horse because a lot of times it is very hard to actually access those teeth at the back of the mouth without some form of sedation. We also are examining the soft tissues, so the palate, the tongue. A common area for oral tumors to form is actually going to be at the very back of the mouth, and horses have incredibly strong tongues. And so, being able to perform a complete oral exam is best done under some form of sedation. So that way we can really do a very thorough oral exam, including that very back area of the tongue and into that oropharynx as well. Because I can reach my hand very far back and I can feel things that are starting to occur in there. We can also use dental mirrors and things like that to actually assess the tooth and look for, loose teeth, periodontal ligaments that are starting to loosen up, lesions within the mouth itself. A lot of times I'll see those very back molars where they've just kind of been chewing on their gums a little bit, and without a little bit of sedation and getting a speculum in there and taking a look, the front teeth may not be nearly as sharp, and then in the back we can have things like hooks and stuff like that that can really be quite detrimental and quite uncomfortable. And sometimes too, without sedation, it's really difficult to actually be able to get the float all the way to the back, particularly the hooks on the lower 11, so those teeth at the very, very back. I've seen some that have hooks, a solid half-inch tall that are starting to actually poke up into the upper part of the jaw. And so, it's really hard to access those without some form of sedation on board. And then, that being said, if there is oral pathology going on, your lay dentists are not going to be able to prescribe appropriate pain care or antibiotics. And depending on the legislation in the state, they're not supposed to perform any sort of oral surgeries. So things like extractions, and this goes for farriers as well. So anything that counts as surgery, you have to have a veterinary license, or it's considered practicing medicine without a license. And so, that's something where we want to make sure that if we're having to do things, that we have appropriate pain medication on board, nerve blocks. A lot of the sedatives have an appropriate pain modulating effect as well. And so, that being said, there are some very capable lay dentists out there that can do a very, very good job, but there's also some that can do a really terrible job as well. And so, overfloating is really one of the worst things you can do. Ideally, you shouldn't take off more than about 4 millimeters of tooth at a time. So sometimes if we have a mouth that's really bad, we have to do it in stages, because when you start getting close to having that pulp exposure, that can be super painful. And then the other thing that I've found that can sometimes happen is that over aggressive bit seats, where you actually will kind of round the surface of those front teeth at the diastema so the bit doesn't get pinched. I've seen some where they've been taken down to almost half the tooth is being taken off, and then you've got root exposure. You're having oral issues. I've also unfortunately had to see some horses where lay dentists have floated them so much so that now they're incredibly painful. They don't want to eat, and they should never be super painful after a
Yeah.
dental. That means too much has been taken and we've started to expose some tissue. And like I said, there's some very, very capable dentists out there that do a good job. But as far as the other stuff goes, you really do need to have a veterinarian assess, especially if you've got oral pathology going on. And
Yeah.
unfortunately, we've had tumors missed, we've had teeth that have gotten worse, and then there's the human safety aspect. If you're looking in a horse's mouth, it's got a big metal speculum on it, starts swinging its head. um, they can injure people nearby. I've heard, unfortunately, some stories of um, dentists and farriers that will sometimes do teeth that the horse is running around a paddock with a speculum in while they're trying to float it, and it's not safe for anyone involved.
Yeah.
So
Oh,
unfortunately, it it is something that in the wrong hands can be very detrimental.
And for
But,
anybody who doesn't know what a speculum is, it is basically this big
yes,
metal gadget that holds the horse's mouth open so you can use, put your arm in and file teeth.
yes,
It's quite like a hefty, I mean, piece of metal
yes, it's
too.
not a
I've
piece of metal that you want to be hit with.
Yeah,
No.
So,
exactly. It's a weapon.
right, absolutely.
Yeah, thank you.
So,
That answers my question.
yeah,
I was
yes,
like, not everybody has seen one or has dealt with this.
right,
I have dealt so we do have a lay, dentist. He's been practicing for most of his life, and he really is excellent. We've had vets kind of there with us, especially when we need to have sedation, but they
right,
are so rare to find, and it's hard to get in with them. Like, we're lucky that we've had the same person for so many years because he only has limited
right,
climates. But, there had been times where I would get a pony and the pony, you think that they're quiet because I have a couple that are perfect. Like, you put the speculum on, they just stand there, they're excellent. And then I had
mhm,
one that just like a switch and the pony was up and over and around and you've got this big
yes,
metal gear on them, right? And you're in there trying to hold this thing and not get, beaten up. It's
right.
dangerous.
Right. And especially, when a lot of what we do going in their mouths is deworming or giving them meds, a lot of
Yep.
them don't necessarily love having things checked either. And, certainly there are very capable lay dentists, that are around that do a very good job. And especially those that are willing to work with veterinarians for the sedation part is very helpful. We've got, several locally that do an excellent job. But there are actually no regulations as far as lay dentists. So,
Yeah.
any person can just buy floats online, hand floats, things like
Scary,
that, and
right?
then just go out there and start doing things. There are
Wow.
some people that do like an online course over the weekend. In school, we're specifically trained what we need to do. We're trained in
Yeah.
the anatomy portion, and so you get a lot more consistency that
Yeah.
way. So,
I would definitely, if you're new to horses and you're just entering, I would work with your vet. And if your vet, we have had referrals into our person, and that's great. But like, it's so rare to find a lay, dentist that is good.
absolutely.
So
And if you look on the AAEP website, which is the American Association of Equine Practitioners, they actually have a horse owners page. And on that page, not only do they have a way to find vets near you, but they also have a veterinary dentistry link as well, where you can find equine vets that do dentistry near you as well. So it's a super helpful page. It's got all kinds of information on it. So yes, right there is perfect. So if you go to the horse owners section specifically and scroll down, there's get a DVM, which is help find a DVM, find a veterinary dental practitioner, horse health, owner guidelines, ask the vet, the disease communication center, the vaccine guidelines. So there's all kinds of helpful information on there, and all of the information on there is coming from veterinarians as well. So depending on who's writing it, a lot of times it may be a regular veterinarian, but also you have a lot of specialists on there too that are also writing it. So they've gotten a specialty in surgery, internal medicine, things like that too. So,
love it. No,
but
this is good. I
super
went ahead
helpful
and put a link
website.
in the comments there for anybody on YouTube or Facebook that wants to hop in. And as always, I recommend bookmarking these.
Excellent. And then any other questions on dental before I move on to the next subject?
No
Any
questions.
All
questions?
right.
Anybody in the
Joy says that
comments?
she has a toothless wonder at the moment and they get soaked beet pulp in cubes 4 times a day. So,
Excellent. Excellent. Small frequent meals is wonderful when they're toothless. It's really helpful because it's physically impossible for them to really eat enough if you're only
Yeah.
feeding them once or twice a day to maintain their body weight. So soaking everything is perfect when they have no teeth. Because if you don't soak it, they will choke and it'll be problematic. And they may still choke even if you do soak it, but the incidence is much less.
mhm.
So um, yes.
So what's
And
next on
if
the
you're
agenda?
super lucky, they'll choke on Christmas Eve, which is what mine did. So, it's just that's what horses do. They pick a holiday and they're like, let's have a problem today. Um, so, next on my list, I've got hoof care. So this is going to be more from kind of a veterinary perspective of hoof care rather than a farrier. And so in order to try to prevent as much disease as we can, we really want to maximize what we can do to improve their movement efficiency. And so a big problem that we see around here is long toe, low heel. And so essentially what happens is you get a broken back hoof pastern angle. So when their foot's coming down, their hoof and their pastern should be about at the same angle. When you get that broken back angle and the low heels, it kind of does this. So it puts more strain on the back of the leg, on those flexor tendons. And it's kind of like if you were, depending on the severity of it, if you were to either be wearing shoes that are too long for you or walking around in flippers if the toes are really long. And, all of us have been there trying to wear flippers and walk around. It's difficult, and that changes the way they move, and it changes the forces that are put on their leg. That is exactly it. Yes. And so if you look at that picture, as you can tell, the angle of the hoof is significantly different from the pastern angle. And so you're putting a ton of strain along that leg, and it's actually shifted the horse's hoof print further forward. So it puts a lot more strain on all of the tendons, ligaments, joint capsule in there. And so that can increase their incidences of tendon injury. It can exacerbate things like navicular syndrome. And so, working with a good farrier, this isn't going to be something where when their foot looks like that, you're going to fix it in 1 or 2 cycles. But the goal is going to be to start trying to kind of build that heel back up, to bring the toe back to where it belongs, because that horse definitely has excess toe out in front of it. And the more toe that they have in front of it that they don't need, the harder it is. Thank you. And then with the broken forward, that tends to be more of your club-footed horses. Okay. There are some things that we can do to kind of help with that, but that tends to be more of a genetic issue rather than a management issue, or sometimes it can be secondary to other conditions. So if you see those kind of long sloping pasterns, we can see suspensory ligament disease that can kind of cause their fetlock to drop a little bit, and then you'll have that broken forward angle of the pastern as well. But a lot of times that broken back is something that tends to be much more easily managed with farrier care. And so, they're all going to be a little bit different because not every horse is going to have the same angles. But in general, the front feet are going to be a little bit more sloped than the back feet. So usually around a 50-degree angle, kind of 45 to 50 is normal. The back feet around 52 degrees is average. So you're looking at kind of that 50 to 55-degree angle in the back. So the back feet tend to be a little bit more upright. And then, that's something where it is going to take time. But if you're starting to notice that, hey, this heel is starting to get lower and lower, and, it's really starting to kind of splay out and have that kind of ski slope toe, talk with your farrier about trying to get that moved back. X-rays are absolutely wonderful for evaluating that, because then you can see how much toe you've got out in front. That can definitely make them more comfortable with how much they can trim off. It's also going to check the palmar angle. And so if you look at the bottom of the coffin bone, which is the lowest bone in the foot, the angle between that bone and the ground is called the palmar angle. And normally that's going to be between 2 and 7 degrees. And so as you can see in the broken forward, it's got a steeper palmar angle, and the normal, it's just barely kind of sloped up a little bit at the heel. And in the broken back, you can see the tip of the toe bone is actually aimed upwards. So that's putting a lot of strain on those structures in the back of the leg. So that's kind of my soapbox on hoof care, is we really want to make sure that we've got good hoof conformation. And then, there are going to be certain medical conditions that will require special shoeing and things like that, which is going to be more of kind of a individual specific treatment rather than a general broad spectrum. But certainly trying to keep those hooves as healthy as we can is going to be wonderful. So
I thought this was good, just to show where you're saying that the angles should sort of match.
Yeah. So
not everyone really understands laminitis.
Yes. So, with the laminitis too, and especially if you look at the picture on the right, if you look at the bottom, so the standing surface of the coffin bone, you can see how dramatically that is angled upwards as you go back towards the heel as well, and that you've got separation of the front of that bone from the hoof wall. And so the other thing that's going to be helpful as far as trying to reduce, tendon and ligament injuries is also going to be improved breakover too. So when you've got that long toe and low heel, it's much harder for the hoof to kind of break over. So when they hit the ground and then push off, it takes a lot more force the more toe is out in front of them to push off than if they've got kind of a short toe and they hit the ground, then they break over more easily. So that's kind of my soapbox about just kind of generalized farrier care. And then we do start to get into more specific diseases. So thrush and white line are incredibly prevalent here. It's wet, it's gross, it's been a terrible winter. I've been battling thrush with my own all winter because it just never dried out. When I lived in North Carolina and Alabama too, where it was kind of more sandy soil, we had a lot of problems with dry feet and cracks and things like that. So that can be very area specific. But certainly, trying to pick out their feet frequently, keeping their feet as dry as you can be very helpful as well. So yes, all
I was
kinds of
looking for
good
a
stuff.
thrush example. That one's not even the best here.
Right.
I've been
And it's hard
struggling
to
with
see in
thrush all winter
pictures.
too. Yeah, we've just
Um,
gotten so much mud. It's like it didn't even freeze. We just got like
right.
nothing but like
Yes.
nasty, like knee
Rain.
deep mud and yeah.
Hmm.
And that's
And
a,
with
a
the
good example. So I'm horrible to speak to this, but I know what I've heard is that thrush smells, right? So I have no sense of smell. People who are just tuning in, but it does, right?
oh,
It'll cause it to
it
stink.
it does get kind of smelly, but also the frog actually does have sweat glands. So like if you have a perfectly clean foot that has nothing going on in it, and you bandage it up and leave it in a boot for a couple days, that'll also stink. But thrush does have kind of a distinctive smell. But what you can really see, especially in that first picture, they're actually sticking their finger in between those heel bulbs, because that groove between the heel bulbs, the sulcus, has gotten deeper where the thrush is kind of eaten in. You shouldn't be able to stuff your finger in there. And so it likes to then live in that nice kind of warm, moist environment. And so, treating it before you get to that point is going to be much more beneficial. But, it's hard to see in the pictures. It's easier in real life. But
Hmm.
with the thrush, you can really start to see that you get that deep sulcus between those heel bulbs. And so, there's lots of over-the-counter products. Usually copper sulfate is one of the better ones to help treat that. But keeping them clean and dry is one of the best things that we can do as well. Um,
I've
And
been
keep
told if you add iodine in with a bottle, like with water, and then you shake it up and then spray it on the feet, that helps kind of kill the bacteria. Is that true?
It absolutely can. So the downside with using iodine is you can kill some of the beneficial bacteria down there too.
Okay.
So it's not something you'd want to do all day, every day, all the time. Really, just kind of using it when needed, and keeping everything as clean as possible, because it's really hard to get thrush if you're kind of standing in that red clay, mud, clean dirt, things like that. But especially when you start getting manure and other things building up, that makes it a less clean environment where it's much more likely to occur. And some are just going to be more prone to it than others. But catching it early and treating it early is going to be much more beneficial than letting it go on, and then you've got kind of bigger fish to fry with trying to get it cleared up. Another
What's
common
your
thing we see
favorite
here.
remedy?
Um, my favorite one has gone off the market, which makes me sad.
Oh
It was
no.
Caraman thrush paste. It had copper sulfate pine tar, and it was nice and thick, and it went in
Yeah, I
there super
remember it.
easily and stayed in there. And now they don't have it anymore. So usually I'll use copper tox or something of that nature. But really just
My copper tox
getting it
is named
open.
Copter Tox. Oh.
Right.
That's
And
amazing.
one of my pro tips on that is if you take a little short piece of baling twine, like 4 inches long or so, and you soak it in the copper tox and kind of dental floss it up into the heel bulbs, it'll help keep that area open and
Oh, neat.
allow some air to get in there, as well as keeping the product on there a little bit better too. So that's one of the things that I find can be really helpful. But oftentimes, just kind of rinsing all that nasty dark gook out of there first will let those products actually sit on the surface of the skin better. So if you're just kind of dumping them on a dirty hoof, you're not going to see nearly as much effect. Yep, that one's the green stuff. Thrushbuster's purple. I find they both work pretty well, but I prefer the copper tox. But either way, they're going to stain the living daylights out of everything. So just be careful when you're using them. Clothing, your horse, your hands, any surface they touch is going to be whatever color that product
Tack,
is for a
the
while.
concrete floor.
Yes.
Your
Yeah.
face,
Yes.
your Genevieve.
Yeah. Your face. Yeah, I've been there.
Right. And then we do see things like white line disease, which tends to be more of a bacterial issue. You get separation along the white line, which is where the hoof wall attaches to the sole. So a lot of times that's going to involve treatment. Usually white lightning is my favorite. So you mix it with vinegar and it creates bisphosphine gas, which will help to kill off that bacteria. But a lot of times working with your farrier to trim out those areas and allow airflow to them can be very helpful as well. And then things like hoof cracks, stuff like that, are ones you want to get on and want to try to manage right away. Hoof abscesses are most commonly occurring through a defect in the white line, and there can be a lot of different causes. So horses with Cushing's can be more prone to them because they tend to be a little bit immune suppressed, especially if they're not well controlled. But the most common place I see the hoof abscesses occur is they like to get a little crack right there at the tip of the toe. And so then the bacteria kind of creeps up that white line and it creates an abscess or an infection in there. So ideally, it's best to go in there and kind of find the area that is the most sensitive on the hoof testers and try to open that up so you get drainage through the bottom of the foot and ideally through the white line, because I find that it takes a while for it to actually drain through the sole. Every once in a while I'll see them by the bars, especially if you've got kind of overgrown bars. I can see them get through there. Or heel bulb are my least favorite abscesses because they seem like they take a lot longer to heal, but ideally we want to get them drained as quickly as we can because that's going to help improve their comfort, because the hoof is essentially a hard structure, and when you've got pressure building up in there, it's like hitting your thumb with a hammer and you get that pressure under your nail, and it's really uncomfortable and it throbs until you get that pressure taken away. And so if you notice that your horse is all of a sudden super duper lame, because they tend to creep on pretty quick, it's definitely worth getting them checked out and trying to get those abscesses drained, because the sooner that you get them open and treated, the sooner they're back to working condition. So appropriate hoof care is going to be yes,
He says heel bulb
absolutely.
abscess is taking an eternity to blow.
Yes,
Why it's so
that is the
important, I
truth.
think, to be careful when you take horses out on gravel roads for the first time. Every horse, I feel like they have different levels of susceptibility too, and there's different levels of stoicism. Because I've seen horses blow
Yes.
some gnarly abscesses and never go lame. And I've had a
Yeah,
thoroughbred that had the
so
tiniest abscess, and he was like, he was done for. His whole leg was
right.
useless.
Right. Yes, there's definitely a difference in sensitivity in horses for sure. I think keeping their hooves trimmed appropriately is a really good thing that you can do to help try to minimize the number of abscesses, because anywhere that there's a little crack in the hoof wall, and these cracks oftentimes will form due to excess pressure being in that area. So when you start getting kind of a longer toe, the center of the toe tends to be the most problematic area to crack, because when you break over, you're pushing over on that point, and if you've got a lot out there, it eventually starts to split, and then the bacteria can essentially travel up that split and create an abscess inside the sensitive tissues.
Can you see
So
abscesses form after you pull shoes? Because now
sometimes they
you've
can go
got
up the nail hole.
yeah.
The nail hole typically is either going to be in or just outside the white line, but sometimes stuff can get tracked up in there and can then creep to the inside rather than the outside. Usually, if the nail hole's open, it's a little bit harder for those to form, just because they tend to have an entry and an exit point.
Yeah.
But if one of those gets sealed over, then it'll pick the path of least resistance, which tends to be into the more sensitive tissues in the inner part of the hoof, rather than try to burrow out the hoof wall, which is made of that hard keratin.
That was gonna
Um,
be my other question. So in the past, we had a farrier that would advocate for using plumber's putty, one to cover holes, but cracks too, and help kind of seal it up. And we had some good success with our thoroughbred at the time. It was very abscess prone and keeping them out. But I wonder if that
yeah,
also could cause an issue of trapping stuff in.
it's kind of a pendulum of, if we can keep everything out effectively, that can help prevent stuff from getting packed in there. But if stuff does get in there, then it has no way to get out. So
Yeah.
you could go both ways on that. And they also make like medicated putties too. The Caramend actually has like a hoof and white line crack paste that's got, I think it's also got copper sulfate in it as well, that you can use to kind of pack in those cracks to try to, one, keep things out, but also two, have an antimicrobial effect. And
Mhm.
then keeping a clean environment is going to be very helpful as well. So the less kind of manure and muck and buildup that you have, the better. I find that when the ground is super wet and nasty and gross, it softens their feet a little bit and can make them a little bit more prone to having the abscess kind of wick up the white line
Yeah.
as it gets softer. We can also see what are kind of termed as sterile abscesses, where you can get a stone bruise, and it's not that you've got an infection that's gone up, but they step on a stone and it bruises the inside of their foot, and they get some of that leakage of the clear part of the blood into that area. So it acts like an abscess, but it's not so much an infection where you've had it come up either through, a puncture or through a crack.
It's more like a
But you've
hematoma.
gotten a bruise. Yeah.
Yeah.
So we can see them that way that can form too. And so sometimes too, using hoof hardeners can be helpful. We don't want to use them so much that we make the hoof brittle. It's not one of those more is more things, but using a hoof hardener can help make those feet a little bit tougher, and getting them out of the wet, muddy ick and onto somewhere dry can be very helpful for their feet too. If you're in somewhere like Southern Pines or somewhere that's a really sandy, dry environment, you may be having the other problem of their feet are too dry and now they're more prone to cracking.
Mhm.
So those you may be looking more at using, hoof oils. And I've even used carnauba wax before to help try to keep moisture in their hoof rather than the other way around. But
Mhm.
Virginia is a little bit different. Everything is just wet and gross all the
I feel like
time.
sometimes we've had it in the summer. It's like every couple of years where you have one of those super dry summers and you are out there trying to moisturize hooves and keep them from getting like that nasty cracking
Yes.
going on that are a pain to
Yes.
deal with.
And so, other conditions that we're dealing with, especially as pony owners, would be laminitis. That is very common, especially if they're overweight. So, really working on keeping them at a healthy weight, especially if you notice they're starting to get a big old crest, fat around their tail head, over their ribs. When you start seeing those regional adiposity deposits, that gives me a little bit of inclination that maybe they're insulin resistant or we're dealing with metabolic syndrome. Sometimes they can just be fat, but there can also be underlying medical conditions that can cause that weight gain. And so I think in a reasonable sense, limiting their access to that nice fresh green grass, and there's a lot that will not control themselves as far as eating. And so we still want them to have an appropriate amount of feed every day. For your average adult horse, about 1.5 to 2% of body weight in total rations is what we want as far as feed, ideally mostly forage based. But the fresh, nice green spring grass that's coming out tends to be very high in sugars, and that can be enough to push those overweight or those insulin resistant ponies into an active bout of laminitis. And so grazing muzzles, you can soak their hay to help kind of pull some of the sugars out, can all be helpful as far as watching their weight or just limiting their total amount of access to those. So we don't want to limit them to where they're not being fed enough and we're not meeting their nutritional requirements, but we should, limit them to how much they actually need per day versus what they believe they need per day.
Right.
What are
Um,
some of the first symptoms of laminitis for pony owners?
Usually what we'll see first is that you'll have an increased digital pulse, so an increased pulse in their foot. You can feel those pulses, and they're a little bit hard to feel at first on the back of their leg. And so, well, not really the back, kind of the back and the side. So if you feel, I find off the side of the fetlock joint is the easiest to feel rather than kind of lower down on the pastern. But if you just kind of lay your fingers across there lightly, towards, basically kind of on the back third of their leg, you'll feel their pulse, and it's going to be pretty slow because their normal heart rate should be less than 40. So usually you're looking kind of, 20 to 40 is going to be your heart rate range. And so it's not going to be like when you feel your own pulse and it's going boom, boom, boom. But if you feel it there, you'll start to notice it's pretty difficult to feel those digital pulses in a normal horse if you're not used to them. If they're starting to get laminitis, and neither of those are exactly where I tend to feel,
All
but
right, I'll
those are
find a better
definitely
one.
both places where you can. But I would, that kind of dark line on the fetlock, that tends to be the area where I'll lay my finger across and feel. So kind of where it meets that fetlock joint is a nice place. So I tend to feel, your mouse was just over at that one.
This one.
Tend to feel in that area. So I find it's a little bit easier to feel, just because there's less stuff kind of blocking it from the surface. So it's a little squishier up there than lower down on the leg. But those pulses will start to feel like they're bounding, so they'll start to feel like they're thumping against your fingers, and that can be oftentimes the first sign when you start getting to reluctance to move, stiffness, lameness. Then we're already starting to have that laminitic flare up. So checking their pulses every day can be super helpful. And if it looks like all of a sudden that's exactly where I feel, just you don't want to actually feel with your thumb because your thumb has its own pulse. But that's the location where I feel
Striking
that
out here.
he's feeling with his fingers on the inside of the leg, because I will hold both sides, but
Yeah.
I just don't pay attention to what's happening in my thumb because you've actually got a nice artery in there, so you can feel your pulse in your thumb. But when we start getting to actual reluctance to move, lameness, a lot of times they may lay down more, things like that. You're already starting to get into that active phase of the disease process.
Okay.
So monitoring the digital pulses is going to be the best thing. And if they even think about looking a little slow, or you're like, oh, they're just not right, or maybe they are really good about picking up their feet and all of a sudden they don't want to stand to let you pick up their feet, I would pull them off the grass just to be safe, and then think about having them evaluated.
How often should you check your horse's digital pulse? Like pulse going in? I know anytime I see something slightly off, swelling, like there's always a trigger for me to check it. It's not like I routinely, as I'm tacking my horse, go down and just check. But now you're making me think maybe I should.
Yeah, you could check every day if you really wanted to, and that might be something just to kind of help you get in the feel for it and get an idea of what your horse's normal is. It's really easy to just take a quick feel while you're getting ready to pick out their feet, or while you're doing something else, getting ready to tack up. I would say, probably once a week wouldn't be a bad idea. But if you're starting to get a little suspicious that something else is going on, I'd check them every day, because it's super quick and simple, and it takes maybe 2 or 3 minutes tops. And especially if you do that while you're doing other things like picking their feet, stuff like that, then you can really start to get used to what normal feels like. So then all of a sudden when it's not normal, then you're like, oh, that's different, maybe I should be worried about that.
Joyce says emergency care for laminitis. Ice. I've also heard about rigid foam insulation on the bottom of the foot.
So lots of different things that we can do. Ice is very helpful if you can get them on ice within the first 12 hours. And actually, ice water is better than straight ice because you get better contact with the skin. They make ice boots. I've seen people stand them in like water troughs and just dump ice in there. Most important is going to be get them off the grass as quickly as possible. If they're on any sort of feed that they don't necessarily need, get them off that, or go with a low starch type feed. And then soak their hay to pull some of those sugars out of the hay will be helpful. If you have bute or banamine on hand, and you can't get someone out there right away to look at it, I'd go ahead and use that per your label instructions, because that can be helpful. The foam is really nice because it gives them some padding, because what's happening is you've got little laminae, which are little connections between the outside of the coffin bone and the hoof wall. And so when you get laminitis, you get inflammation of those. And then because of the pull of the flexor tendon, it's then going to pull that coffin bone down and away from that joint. So you actually get separation of those little finger-like projections in the foot. And so that's acutely painful when that happens.
Yeah.
And so we want to try to get on that right away to minimize the amount of separation and the amount of rotation. So ice is great. Getting as much sugar out of their diet as possible is going to be helpful. There's lots of different things you can do. Soft dried boots are amazing. They're basically kind of foam boots that are designed specifically for laminitis. I like those. I think they're like kitchen mats, or they look
Standing
like
mats,
big
right?
jigsaw puzzles, and they have some that are more like industrial slash garden use, and they're a little thicker, so they don't compress as much. But you could easily put several layers on, and you can duct tape them to their feet. You can shove them in boots that you already have. Just it gives them a nice amount of cushioning, or put them in a stall and double or triple bed their stall. Just something to give them some padding and some support. Ice is very helpful, but the biggest thing is try to remove what we suspect the inciting cause is. And in most cases, it has to do with being overweight, insulin resistance, and then having a sudden change in the grasses, the sugars. But there are certainly some other issues we can see. Colitis as an issue. We can see black walnut shavings can cause laminitis in horses. So there are other causes outside of that, but the most common one is going to be weight related, and particularly insulin resistance. But getting on it right away as soon as possible is going to be the most helpful, because then you can try to stop that disease process as quickly as you can before you get excessive rotation.
That's good to know. Yeah.
Excellent. And then
And I
kind
had
of
never
next.
realized that's
Yes.
why ice was so important, really. Like, again, just connecting the dots with
Yeah, so you're trying to
reducing the
minimize
opportunity.
the inflammation. So the
Yeah.
itis part of laminitis just means inflammation of the lamina. So you're trying to minimize that inflammation as much as possible. And then the next thing is we want to actually maintain the blood flow to the tip. So as that bone starts to rotate downward, we can actually see that it hits that blood plexus in the foot, and we can
Mhm.
actually start to see loss of blood flow there. So there's other things there, but right away getting them off the grass. And if you can do ice safely, wonderful. If you can't, sometimes you can cold hose, but getting them on as soft a surface as you can. But I really like those little jigsaw foam mats. That's a lot of times what I'll do in the field, is cut out some custom pads and try to get them on those right away, just to help improve comfort. So the
Cool.
softer surface you can get them on, the better. And
Nice.
then kind of next on my list of stuff is navicular disease. So very common to see, particularly in quarter horse types, as well as some warm bloods. We do see it as well. And so navicular syndrome isn't just one disease. It's kind of a complex variation of things that can contribute to what's also known as caudal heel pain. So basically pain in the back of the foot. So it can be from the deep digital flexor tendon, it can be from the navicular bone, the navicular bursa, the impar ligament, or the suspensory ligament of the navicular bone. So there's lots of different things that kind of feed into that. There's several different theories, as well as why this can occur, whether it's that we've got a vascular disruption to those structures. Perfect. So the navicular bone is that little bone right there on the back of the heel. It acts as a pivot point for the deep digital flexor tendon. Because if we didn't have those little, essentially sesamoid type bones, when a tendon pulled, it wouldn't actually bend a joint. It would just pull straight, and then you would have no bending there. So there's some theory behind, is it that we've had a vascular issue, and that's why we're seeing issues, particularly more related to the bone itself? Is it a biomechanical issue, and that we've got abnormal forces on the foot? We've got medial to lateral imbalance. We've got some other issue causing excess strain there. Or, the kind of longest standing one is, do we have an arthritic type process going on? So it depends on really the underlying cause and what's going on. But that being said, this is yet another reason why we want to make sure that hoof pastern angle is appropriate, because if we've got that broken back angle, it just puts more strain on those structures. And having your vet do a lameness exam if you're starting to see a lot of times an intermittent front end lameness, or sometimes it might be one foot, sometimes it might be the other, or sometimes they just have a really short choppy gait. And I find especially horses with heel pain tend to land on their toe. So instead of landing flat on the sole of their foot, they tend to kind of land toe first and then put their heel down. So they have a lot of times a short choppy gait. So that would just be something else where you're using a combination of both medications and farrier care to help maintain that to the best of your ability. And then kind of the final thing on injury prevention is appropriate conditioning. So, if you're not exercising your horse and then you're expecting it to go out and gallop turns and run races, you're much more likely to get injuries when they're fatigued. And if you haven't built up that appropriate muscle, there's also benefits to conditioning as far as bone development as well. So it's another one of those kind of, if you don't use it, you lose it things. So one of the biggest things is going to be, are we appropriately conditioning them for the work that they're expected to do? Weekend warrior horses oftentimes do end up having a little bit harder of a time because, they may just sit there in their field for a couple weeks and then, maybe go on a trail ride. And if it's, a nice, easy trail ride that's flat and maybe a couple miles, probably not going to be an issue. But if, you're a weekend warrior, say in, the West, and your trail ride is 12 miles of incredibly rocky trails up the side of a mountain, that can be very problematic if you're not in shape to do it.
We've all seen
So
people who've pulled a pony out and just taken it, to competition one weekend and
guilty.
just I think we've all
But
done it at
also,
some point,
we're
right?
not
Like,
going
just
fast.
professional life necessitates it, but you're right, like, we really need to do better in a way, right?
Yeah,
Right.
sometimes
And
people
I'm
just
gonna
need
say
a
my
pony, and it's like, if you
competition
have
is
a pony, it's like, okay, well,
Yeah.
I'll loan it out, but he's not in shape, so be gentle.
right. And I will say my level of competition is probably not up to you guys' level of competition either, because I'm like, oh, we're just gonna trot this, no big deal.
Just
Like
have
I'll go as
fun.
fast as the pony wants to, as long as I don't fall off, it's a good day. So, but that is definitely something that can help as far as injury prevention, both before and during competitions. And then
I saw something on trying to get at least 15 minutes of walk in. Why is walk so beneficial?
So that's going to be what helps to warm up your muscles, improve your blood flow. You also will start to get more elasticity of your joint capsules as well. So it's kind of like with human athletes, it's essentially you're stretching. So as we start improving the blood flow to those muscles, we're less likely to have injury. It's also going to help at the end of the ride kind of disperse some of that lactic acid that can build up in muscles and make them sore. But when you first start moving, those tendons take time to work up, to warm up, and then also the joint capsules are less elastic when you first start going. And so as you start to move along a little bit and get warmed up, then you'll start to see that those structures will start to have a little bit more flexibility. And the more flexible they are, the less likely you are to then have a tear. So that's why it's so important to walk. The other thing that we get out of all that walking is we also have that little bit of concussion on the bones as well. And so that starts to build up some bone strength as well. So I actually, during vet school, I boarded my horse at a world-class endurance facility. And so my fat quarter horse mare looked fatter than all of their pregnant mares out there. But their conditioning for these 50 and these 100-mile races was they weren't even really starting these horses under saddle till their skeletons were fully developed. But then we were spending quite a lot of time on the hot walker, getting them walking, getting them moving, building up that bone, getting that endurance for those tendons and those ligaments before we even started any type of speed work. So,
Oh, wow.
most of their conditioning was in fact a significant amount of walking. So 2 or 3 hours of walking a day with intermittent trotting and cantering sessions. So usually about 20 to 30 minutes daily of trotting and cantering sessions. Plus then we'd start doing longer rides, actually getting out and going, which I had regrets the first time because their version of a short ride was 12 miles with a lot of trotting and cantering. And I thought I was going to fall off the horse and die. I was like, if it even turns slightly too hard, my legs will just give
Like, I'm
up and I'll
done.
fall off and that'll be it. I wasn't even sure I'd be able to stand up at the end of it, but it was really a lot of fun, and it actually is very beneficial to keeping the longevity of your horse. The as much as it's not exciting compared to a lot of other things you're doing, the walk really is very beneficial to building up a lot of those structures and keeping your horse as healthy as you can. And then I'm not sure how much time we have left, but I have an entire section on joint care.
Oh my
So
gosh.
I can kind
Well,
of
we're
run through
at
that
the
fairly quickly.
9:15 mark here, so is there
Well, I
any
can,
questions? I think we should ask first
Excellent.
before we jump into joint care, or should we save joint care for next week? I'm starting to think we
I
should.
was gonna say I might just talk for too long next time too, but I can kind of go through it relatively quickly as
I think
well, just
joint
kind
care
of an
is so
overview.
important. I know a couple of people that will have questions. So
Okay,
if you guys want
excellent.
to comment, do you guys have any questions now? Do you want us to jump into joint care next week? I need some feedback in the comments section here, guys.
Yeah, I'm
Give
curious to
them
know what
1 second.
everyone thinks. I'm leaning to okay, Joy's saying next week. She's
That's
saying
what
next week.
joint care to
Okay.
me is one of those things I almost don't want to rush and want to be able to take some time and prepare.
Yeah, I feel like that could
Because
be
I
Right.
have some good questions too on
right.
Excellent. And,
preventative,
the downside is a lot of it is going to be kind of individually tailored, but I can definitely go over kind of the generalities of it and the different options that are available as far as
Yeah.
joint care. And then if I would spend less time talking about random stuff, I would probably have more time to get through it.
No,
But
you're
then
good.
next time, what I really wanted to kind of focus on was like, now we're going to show the coming up here in the next, say, like 48 hours or whatever,
Yeah.
what do I need to do to try to prepare for that? So
Yeah.
So we'll open
try to
with
keep
joint
it
care
succinct.
next
So
week, and then let's get into show season
Competition.
is upon us. We'll
Yeah.
we'll be able to kick off
yes,
April.
Yeah. That'd be
yes.
great. Let's do
Guys,
it.
So
the MA season is about to start here. So our Mid-Atlantic series is so close, and we get to go back into show season after the long winter.
yes, and I saw the
I'm
entry is up, so
Yeah,
Yes,
I
get
was
it
gonna
everybody
say
is.
signed up.
couple of competitions coming up, right? I know that there's gonna be the PA pairs that Fred is hosting. So you guys go check out the MGAA website, Amount of Games Across America, and look at the calendar section. You're gonna see a whole bunch of listings. We've got our MA1 for the Mid-Atlantic series is gonna be coming up in May, right?
Yeah.
I'm like
End
April,
of
Yep.
May.
May. So it's in about
I think
a
May
month and a
18th
half.
and 19th,
Hmm.
I
Yeah.
believe.
And then we've got
Yes.
MA2 is going to be in May. We've got the Southern Series kicking off in May as well. So just the whole show season is starting to ramp up. I know that there's going to be the pairs competition that's hosted in Pennsylvania. There's going to be a pairs competition in April hosted out of Prince George's Equestrian Center. We've got a little scrimmage shindig that we're going to be doing on the 21st here in Hillsborough, Virginia. So super excited, guys. The
Yeah.
season is
And
upon
I
us. And
I did see the Pony Club one in Charlottesville. So any of
yes.
you Southern Virginia people, it's actually not that far from here. So, it could be super fun.
Are you going to be going?
I'm planning on trying to sign up because it's only about an hour and a half for me, and so that's probably the closest that I'll ever get to actually being
Do
being
it.
here. So
Yeah.
yes.
Perfect.
So, and also for people that are local to this area too, it'd be a great opportunity to get out and actually see what Mounted Games is about. Because a lot of equestrian events are up in the Charlottesville area, and it's not too terrible of a drive from here. So
I was just looking to try to see the information on it here. Um, I'll definitely let's check it out though, because yeah, you're
I
right.
think it was on the
Representation.
Facebook page. It is a Pony Club
There
associated
you go.
one.
Mounted Games Rally, Saturday, May
Yes.
4th.
Oh, the fourth. Okay.
It's going to be Virginia Polo Center in Charlottesville. So Skyline
Oh,
Pony
cool.
Club at the Old Dominion Region Games Rally. You guys, if you are members, go on to the Amount of Games Across America MGAA official page, and the information is posted there if you guys are interested in competing. So we have some good representation down in Southern Virginia. Check it out. And I know Caroline O'Connor is also trying to host some practices and scrimmages coming up too, down in that region as well. So
I
so
guess I should
excited,
probably get on
guys.
my pony.
I
Now that I've
know.
been on my soapbox about conditioning, I should probably actually get on if it ever stops raining.
It's a good
So,
reminder, right, to get out there and just get started because it's going to come up faster than you know.
Right.
And you want to be
oh my
ready.
gosh.
So, you guys, thank you so much for attending tonight. Next week, we will continue talking about joint care and then launching into the April start of our
Yeah.
competition season. So, you guys have a wonderful evening. Thank you so much, Caroline, for joining us. And we
Thank
look forward to having you
you.
Oh,
next week.
Bye, everybody.
all right.
Bye.
Bye.